The technician at the MRI said, okay, you can watch the machine while we do the MRI. And then he said, do you see this portion of the screen here? When you get back over there, you need to immediately get a physician or someone to look at this and know that she probably needs immediate attention. And he said, but do me a favor, don't tell anybody that you were in here with me or I could lose my job. As Amy was being wheeled in by the techs, I grabbed the nurse that was there and I said, I cannot explain this to you, but you have to get those MRIs read right now and see what needs to be done for her. Shortly thereafter, they did a bedside hematoma drain. I really think that had they have not done that, Amy would not have survived.
Definitely the odds were against me, and I was saved. And I don't know exactly why.
Amy's story illustrates what the program in compassionate communication will do. We will be partners with patients and their families. They'll be more empowered, will make fewer mistakes, and they'll get the care they want.
My dad's diabetic, and when he went to go pick up his medication, he realized it was the wrong medication. My dad grew up in a culture that you respect healthcare, you respect people in authority, and so therefore you don't question them. The pharmacist repeatedly told my dad that this was his name on the bottle, and therefore this was his correct medication. And feeling very frustrated, my dad left the pharmacy. I later spoke to a different pharmacist. The pharmacist was very helpful, took his time and communicated to me, asked the right questions, and later did discover that my dad was given the wrong medication.
Our patients are all individuals outside of our clinic. We see them as names, as birth dates, as a list of problems and medications, but they are whole people. And having a little extra time in order to understand them as a person and see their journey, that really makes a big difference.
It's been like riding a roller coaster in the dark. When I go to a physician, I'm possibly in anguish or distressed or depressed or whatever, and they can't pick that up. It's a very lonely place for me. It's not just physicians that I want a connection with. I want all the people who are treating me to be able to connect, dealing with me as a person. I may be really sick at some point, but I come out just with a better sense of well-being. I'm not all alone.
Our focus as providers has shifted and away from patients and what they really need. And all of these amazing advances that we have, we really need to tilt the needle back. I think we really need to refocus ourselves on the whole person.
You know, I would love to see the medical community, the healthcare community, come from a more loving place. And what would that look like? What could that look like?
What motivated me to go to medical school was people and really caring about who they are and helping them live better and healthier lives. Empathy is a skill, and it's something that you have to practice over and over and over again.
I think the benchmark here is not just that a doctor comes into the room and tells me what I have and speaks in eloquent scientific language about the latest and greatest treatments and offers me the very best that money can buy. I think patients here expect that their physicians, their nurses, their healthcare team are going to sit down across from them and treat them like human beings.
It's going to take a sea change. Sort of like dads in the delivery room. Things are very different now than they once were, only this is much bigger. It's going to mean that the entire community stands up and pushes back, and together we make things change.
Moral courage is when you've got the courage to actually do something yourself, including that it is more than when you merely suggest that other people do it.
It's something the Ethics Center's prepared for 25 years. We've made profound changes in end-of-life care. Now it's about the entire lifespan and every setting of care. It's big, and together we can do it.
I think that all healthcare providers would appreciate having the opportunity to recenter why they're in medicine.